All right, let's dive right in. Today, on this explainer, we're looking at something that is just fundamentally reshaping the entire future of healthcare. We're talking about the incredible, truly transformative power of artificial intelligence in the medical field. And to do that, we're going to draw on some absolutely fascinating insights from Dr. Robert Wachter. He's the chair of the Department of Medicine over at UC San Francisco. He recently broke down exactly how AI is shifting the ground beneath our feet. So we're going to explore what helps, what's risky, and how we are basically building this plane while we're flying it.
So think about this for a second. What happens when the ultimate answer machine actually goes to medical school? It's a huge question, and it's forcing us to completely rethink how future doctors learn. Honestly, nobody really knows what a physician's daily life is going to look like 30 years from now, which, if you think about it, is exactly the massive bet a first-year medical student is making right now, today.
Let's move to Section 1. AI meets medical education. New skills versus old baggage.
Look, the demands of our modern healthcare system they're immense. You could even argue they're completely unmeetable without AI at this point. And because of that, medical schools are facing a really urgent curriculum crisis. They basically have to weigh the old baggage against these critical new skills. Like, do students actually still need to memorize the complex intricacies of the Krebs cycle or the exact mechanisms of 10 different seizure drugs? Well, probably not. Instead, they're going to have to trade that old rote memorization for things like AI fluency and change management. They need to build the flexibility to adapt to new tools, while, and this is absolutely crucial, fiercely protecting their core diagnostic reasoning.
Okay, Section 2. How AI helps students. The infinite patient coach.
Here is where we start to see the mind-blowing promise of AI in the classroom. It can perform these highly personalized tasks that human attending physicians just literally do not have the hours in the day for. Imagine being a medical student and you're about to have your very first end-of-life discussion with a patient. That is terrifying, right? But now that student can go to the AI and say, hey, I'm about to speak with someone who has metastatic lung cancer about resuscitation. And the AI, it just steps right in. It acts as an infinitely patient coach, role-playing the entire scenario until the student can walk into that real hospital room with practiced confidence.
And the benefits go way beyond just role play. You know, human doctors are incredibly busy. They almost never have the time to sit down and watch a student's full hour-long patient interview. They usually just rely on a really quick 5-minute presentation of the case later on. But AI has all the time in the world. With the patient's permission, an AI can evaluate that entire recorded interview and provide incredibly detailed, real-time feedback on the student's technique. It completely frees up the attending physician and opens up these massive educational opportunities that were just straight up impossible before.
All right, Section 3. The risk of never skilling. The dark side of shortcuts. Now, we kind of have to shift gears and tone here for a minute, because what serves as this brilliant burnout-reducing time saver for a veteran doctor with 30 years of experience, well, that exact same tool could be absolutely disastrous for a day one trainee. And it all comes down to something called productive friction. Basically, this is the necessary struggle. It's the intense mental effort required for a student to build those foundational neural pathways. When you talk to a patient and then you actually have to struggle to figure out how to organize all that messy information into a clinical note or formulate a diagnosis from scratch, you are building a critical cognitive foundation. So bypassing that productive friction by just handing a student an AI scribe too early, it totally prevents them from ever developing their own clinical logic. And that lack of productive friction builds into an even scarier danger, which is known as never skilling. So we've all heard of de-skilling, right, where you lose a skill you used to have. But never skilling is the very real risk of a student failing to learn fundamental clinical competencies in the first place just because they over-relied on AI tools from day one. I mean, imagine a doctor who never actually learned to generate a differential diagnosis completely on their own. No way. So you can see how this sets up a massive problem. Clinical tools like open evidence are incredibly powerful, and they are literally only getting better. But if we let these tools do all the heavy lifting, if we have them spoon-feeding differential diagnoses before the student has put in the mental sweat equity, we are completely bypassing the foundational layers of medical training. Dr. Wachter actually summarizes this risk with some serious weight. He says, if you become dependent on a tool to outsource your thinking, you're going to become dumber. I mean, wow. That is a stark, stark warning. The consequences of outsourcing a medical student's developing brain to a machine could literally compromise patient care for an entire generation. Which brings us to Section 4, preserving the human foundation, merging mind and machine.
So, how exactly can medical schools safely integrate this incredible technology without destroying a student's fundamental human skills? Well, Dr. Wachter proposes some pretty brilliant fixes for this. First off, we need to program the AI so that it doesn't just hand over the answer right away. Instead, the AI actually has to demand the student's hypothesis first. It should be there to critique human reasoning, not replace it. We might even need periodic AI shutoffs in hospitals just to test a doctor's core competency. The whole key here is forcing clinicians to put a nickel down. They have to commit to their own medical opinion before the AI offers any clues whatsoever.
You know, it's fascinating seeing how students are reacting to all this. We're actually seeing the rise of what people are calling the AI vegan. Basically, students who plan to completely refuse AI tools out of this deep fear of de-skilling. But as much as being cautious is great, completely rejecting AI is definitely not the answer either. You have to know how to use it in the modern world. The real solution is, well, it's eating your spinach. Students still have to endure that grueling, unassisted work first, because that is exactly what builds the foundation.
To borrow a super vivid analogy directly from Dr. Wachter, educators are going to have to look at these medical students who are rolling their eyes, students who know perfectly well that an AI could do the task in 3 seconds, and just say, "Eat your spinach, this is good for you." Students absolutely must become highly competent in the complete absence of AI so that they can actually be a critical, effective partner with the technology later on down the line.
And you know, this disruption touches absolutely everything in academia, even something as traditional as medical school applications. Take the classic admissions essay. With AI writing assistants everywhere now, educators can't really just judge the quality of a student's prose anymore. Instead, the essay actually becomes a test of the applicant's true priorities. Like, what prompt did they feed the AI? Did they ask it to highlight their fancy lab research or their time spent caring for a sick grandparent? AI is basically forcing us to assess the human intent behind the machine's polished output. Which leaves us with this one final, really striking thought. The next time you walk into a clinic or a hospital, I want you to ask yourself, how much of your future doctor's brain do you actually want outsourced to a machine? It's a wildly delicate, high-stakes balance between embracing these revolutionary tools and preserving the fundamental human expertise that actually saves lives. Thank you so much for joining me on this explainer, and keep questioning the technology that's shaping our world.